What does an initial patient visit look like at the Heart Attack and Stroke Prevention Center? When you arrive at the Heart Attack and Stroke Prevention Center of Central Ohio, you'll be greeted by our concierge patient coordinator. You'll sit down with me for briefly for perhaps 5 or 10 minutes while we talk about your goals, your concerns, and then we're going to immediately start some testing. We do some blood testing initially, and one of the tests that we do is a 2-hour oral glucose tolerance test. So that involves getting a fasting blood sugar test done. You'll drink a known quantity of a glucose drink, and then we do 2 more glucose tests at an hour apart. And the reason we do those tests is because while most doctors will do just a fasting blood sugar to see if you have diabetes or if you're insulin resistant, and they may very well do a hemoglobin A1C to look at your blood sugar level over the past 3 months, just looking at a fasting blood sugar and looking at a hemoglobin A1C will probably miss half the people who are truly insulin resistant. And as you may recall from one of the earlier talks, insulin resistance and diabetes are a huge cause of inflammation. After the initial round of blood tests, we're going to go sit back down again. We're going to go through your complete medical history. We're going to talk about your family history. We're going to talk about root causes. We'll talk about red flags that can be a warning sign of inflammatory processes. Things like autoimmune diseases and lupus and rheumatoid arthritis, other disease states like polycystic ovarian disease, and that sort of thing. The next step is going to be a complete physical examination. We're also at that time going to do an electrocardiogram, and we'll do the CIMT. That's that carotid scan that we do, looking to see if there's any evidence of inflammation in your arteries or evidence of plaque in the arteries. You will then be handed over to the dental portion of the office where you're going to be undergoing a periodontal exam, and Barb is much better suited to talk about that than I am.
So at the Complete Health Dentistry of Columbus, we really are looking at the mouth and the body connection. And I am an advocate for my patients, not just their oral health, but their overall health. It's often stated that the mouth is the window to the rest of your body. So by being in partnership with Dr. Goulder, I am ruling out sources of inflammation that could drive heart attacks and strokes. So as a dentist, I'm responsible for finding the root causes that can drive inflammation. And the 3 that are in my arena are periodontal disease, root canal lesions that are often silent, as well as sleep apnea. Many times infected tonsils and infected sinuses can also contribute to the bacteria that travels throughout the body. So I'm constantly on the lookout for sources of infection that I may find on an X-ray. The most difficult and challenging part of being a complete health dentist is discussing with my patient the implications of the infection that I find in their mouth that they don't even know they have. Everything feels fine, there's no pain, there's no swelling, and I'm here telling them that they have a source of infection that actually could kill them. So what do we do different here at the Heart Attack and Stroke Prevention Center? So we do saliva testing at the center, which actually tests 11 bacteria that live in your mouth that can actually drive other systemic diseases: Alzheimer's, cancers, cardiovascular disease, preterm births, as well as infect artificial joints. So it's a simple 30-second saliva test where we swish and spit into a tube with a salt solution, and we send it to the lab and we get a report that looks something like this. And as you can see, there are different colors that affect different parts of the body. We have high risk, moderate risk, and low risk bacteria. At the Heart Attack and Stroke Prevention Center, we are primarily looking at 5 high-risk bacteria that we know live in the mouth, and research shows that these 5 bacteria can actually trigger a heart attack or stroke. So that's why the importance of a saliva test helps us personalize our treatment and your care to help eliminate the chances of a heart attack or stroke. This is also good for somebody that may be thinking about being pregnant, getting your teeth clean and having a test like this, as we understand that some of the bacteria can travel across the placenta barrier and can cause risk to your unborn fetus. 80% of the population has some form of periodontal disease, and 50% of unexpected heart attack or strokes are driven by oral bacteria that live in your mouth. 50% of unexpected heart attacks or strokes are driven by this bacteria. So as you can see, this test is very important. If you're going to get an artificial joint and your orthopedic surgeon asks you to have a dental clearance, it's really important, as some of these bacteria can travel through the body from a bleeding gum and compromise the healing of your artificial joint. This is an example of an X-ray that we take. It's a 3D cone beam, and it helps us identify sources of infection that you may not know you have. These are 2 root canal teeth that actually have infection at the root tip, and these infections are full of toxins and are often silent, and they travel through your body that can contribute to heart attacks, strokes, cancers, and Alzheimer's. It also can trigger high blood pressure. Obstructive sleep apnea affects 1 out of 5 adults. Obstructive sleep apnea is the most undiagnosed medical condition. Obstructive sleep apnea is a medical condition, often with a dental solution, depending on whether it is mild or moderate as a diagnosis. Obstructive sleep apnea can take 10 to 15 years off of your life. If you are diagnosed with obstructive sleep apnea, it is equivalent to smoking a pack of cigarettes a day on your cardiovascular system. As a dentist, and looking in your mouth, we can identify signs of sleep apnea such as narrow palate, large tongue, scalping on the edges of the tongue, wear on your teeth. These all point to possibilities of sleep apnea. On this X-ray, you can see the airway is restricted. I want you to understand that this patient is standing up in the X-ray unit versus lying down in bed where the tongue and the jaw falls backwards. This patient is a high candidate for sleep apnea. So as a complete health dentist, I play a major role in helping Dr. Goulder with the oral systemic connection. What I want you to realize is there are a lot of dental infections that are silent. So testing will help us discover whether or not you are at risk.
The final part of the initial risk assessment is getting genetic testing done. This is once again a very simple 30-second swish and spit test done on the saliva, and we'll get the results back in about 3 weeks. So that last test takes the longest to get back. Our patients usually come back approximately 3 weeks later when we have all the reports and all the blood work back. We'll go over all the results with them, give them recommendations for lifestyle modification, for diet changes, recommended prescriptions for them, recommended supplements, so that we can get the whole inflammatory process under control and allow that atherosclerotic plaque to start healing. So we encourage you to contact the Heart Attack and Stroke Prevention Center of Central Ohio. Certainly if you have any questions, or if you'd like to make an appointment to be seen as a patient, or perhaps get a CIMT done to see what your standing is regarding atherosclerosis. We at the Heart Attack and Stroke Prevention Center of Central Ohio certainly look forward to hearing from you about any questions or regarding scheduling an appointment to be seen to be evaluated. And one more time, please don't forget, heart attacks are optional.